Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright, News and Public Affairs Director here at WNCU, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. The North Carolina Department of Health and Human Services, in partnership with North Carolina's historically Black colleges and universities, are concerned about students' mental health during COVID-19. They're engaging in partnerships to assess the mental health needs of minority students on campus and the effects of the impact of the pandemic. Peeling back the layers on minority mental health is the focus. And here to talk about this topic is Deepa Avula, Director of the Division of Mental Health, Developmental Disabilities and Substance Abuse Services at NCDHHS. Hi, Deepa, how are you?
Hi, I'm great. Thank you very much. Thank you so much for having me today.
Oh, it's no problem. When I saw this topic, I was excited, invigorated, because WNCU is on the campus of North Carolina Central University. So the students here on our campus would definitely benefit from what you guys are doing. So
Sure.
Talk about some of the normal stressors for college students without COVID-19.
Yeah, so even without COVID, college is a pretty stressful time for students. You're really entering a different phase of your life. Often college students are referred to as transition age youth because you really are moving from that phase of sort of being a kid, being a teenager to really being an adult. And while that's really exciting and independence is exciting and doing your own thing is exciting and kind of being in charge of your own studies is exciting, it's also really scary and also very anxiety provoking. And in many cases, your friend system is changing, your social supports are changing. Often you're living in a different place without your parents or without your caretakers, without your guardians. So all of that can be quite stressful for students.
That is so much for them to be concerned about, especially if they're coming in as freshmen and then you're a sophomore, you got more abilities, junior, senior. So what are some of the mental issues that you're concerned about on HBCU campuses with COVID?
Yeah, so particularly with COVID. So on top of all the stressors I've already mentioned, now you add to it isolation, you add to it potential grief, potential trauma, all of these things that students are experiencing, and the normal college experience, the things that, going to parties, being social, leaving your dorm room, doing all those things have become very difficult, if not non-existent in the last 2 years. So all of that is very, very stressful. And we also know that individuals of minority backgrounds have higher rates of mental illness, and they have harder problem accessing services. So that's one of the reasons we're particularly concerned about HBCUs and the African American student population.
Yeah, you mentioned isolation just a second ago. I talked to some of my students. Actually, I did a COVID conversations with them to find out how they were feeling through the pandemic and working on their studies. And they mentioned isolation, like some of the things that they would normally be doing, like going out, hanging out at parties, or in their study groups, or doing just normal things. They are in their rooms. Yeah. Times, or they're isolated with their families a lot of times. So can you talk a little bit more about that isolation and like some of the mental effects and maybe how they could even work through that?
Sure. So isolation is a great contributor to things like depression, things like anxiety, feelings of sadness, of hopelessness. One of the things, particularly for young people, particularly for this age group, really their biological makeup is such that they crave socializing, and often it's irritating to parents and other adults to see adolescents and young adults always want to be around friends and always want to be socializing. There is actually a biological kind of compunction for that. And so when you remove that, when you really kind of almost force an isolation as by necessity, that can be very disconcerting for young people, particularly for this age group. And again, particularly at a time when so much of how you deal with normal stress is through your peer group, is through, like you said, hanging out, going to a party, having a coffee after your class, like all of those things that all of us did, to get through the stresses of this time. They're not as accessible to students anymore.
So I guess that they're probably like wandering around, like looking for some kind of lifeline to help them. So what are some of the mental issues that you're concerned about on HBCU campuses?
Sure. So certainly depression, and by depression, really, the range of depression can vary. So feelings of general sadness, feelings of hopelessness, feelings of loneliness, not being able to sleep as well, not having appetite changes, when your activities that used to excite you or bring you enjoyment don't anymore. Those are some signs of depression that would be very concerning. Also feelings of anxiety, feelings of fear, like once sort of restrictions are lifted, are people still afraid now to go out? All of that contributes quite negatively to an individual's mental health.
So tell me then, what kind of data are you relying on to measure how hard African American students are being hit by COVID?
Yeah, so there are a number of different sources of data, national data, to tell us that individuals across the lifespan have seen increases in depression and anxiety throughout the pandemic. We also know that suicide attempts, for example, were increased in 2020 in the young adult population compared to 2019. And then the data also tell us that for African Americans, their rates of depression and anxiety are higher than their white counterparts. So we do see that disparity in the data as well.
So what are HBCUs doing to best help students who are working on getting an education? What do they have to look forward to?
Sure. So HBCUs do have counseling centers. They have help and peer support available. They obviously also have sort of a very unique network of a support system. And one of the things that we're going to be doing this week when we talk to our HBCUs is we really want to hear what are some of the best practices are from administrators, what they've implemented that seems to work on their campuses, and also what seems to be working for students.
Very good. So mental health issues, like they span the gamut. It doesn't matter if you're African American or if you're Native American or whoever you are, then you have mental issues. So what makes African American students' mental issues different from students who are at predominantly white universities?
Sure. The underlying issues themselves, in terms of the stress, they may not be any different, right? They may be the same. But one of the things that we've seen over time with data is that access to mental health care services, there's a disparity. When you look at the data in terms of who's accessing the services, African Americans do so at a lower rate. And many of the reasons could be because of just access to the services itself. Another kind of factor in that is that the number of professionals in the field that are African American is quite small relative to the number of individuals that need services. So one of the things we're continually doing at the department is looking for ways to encourage minority populations to go into the mental health care field so that students seeking services can, if they choose, seek a therapist, seek a counselor that looks like them. I think that's the data show that it's very important for some individuals that they really do want to see a counselor or a therapist of their same minority background.
So when you're talking to administrators about this and then trying to find out more information about students and COVID on their campuses, what is it that they're saying that they need the most of?
So I think one of the things that, well, there's a few things. One is obviously resources for programs, right? In order to have these types of programs that I'm describing, you need resources, financial resources for that. The other thing is across the board, no matter who we talk to, we hear repeatedly that we really need to together break down the stigma associated with mental health and mental illness issues. Unfortunately, there's such a stigma out there in society in general, particularly among young people, about seeking help for these conditions. So we're hoping that conversations like this one that we're having today, conversations like in our HBCU summit, that those can go a long way in breaking down stigma. Because one of the things we really want to stress is that it's okay not to be okay. It's okay to ask for help. We want people to reach out for help when they feel they need it. It's much better to ask for help earlier than it is to try to wait and figure it out yourself. There is so much help and resource available, and we want to be able to ensure students especially that they can ask for that help and not feel any shame with that.
So talk about the kind of help that would be available then for a student who would seek services and help?
Sure. So for example, if a student is feeling depressed or anxious, the Department of Health and Human Services has a 24/7 call line that is answered by trained crisis counselors. It's called Hope for NC. And that number is 1-855-587-3463. Again, that's 855-587-3463. That's Hope for NC. And if a student, again, is just not sure even what they're feeling, they can call that phone number and talk to a trained person to help them kind of navigate through some of their feelings and issues. And if they need subsequent help that of a more serious nature, this call center will connect them to that resource to provide help as well. And as I mentioned, colleges and universities have counseling centers on site as well if a student prefers to do that.
So how did you find out that African American students need more mental health care? Are there studies out there?
Yeah. In general, there's a lot of data that does show that the disparity in African Americans, again, seeking care, getting care, it does exist. That data, unfortunately, is pre-pandemic. That's not because of the pandemic. That's existed for a while. As you know, there's disparities in all forms of healthcare, unfortunately, and unfortunately, behavioral healthcare is no different.
So does it go like beyond stigma? Is there any socioeconomical things that would keep students away from seeking help?
Sure. Yeah. Yes, yeah. It goes. Yep. Definitely goes beyond stigma. It's that. It's also adverse childhood experiences also have an effect on an individual's mental health, socioeconomic status, as you mentioned, access to care while growing up. All of those things contribute.
Mm-hmm. So then, how would it show? So if I'm like completely stressed out, what would that look like? Or if I'm completely just feeling like my isolation is taking over and getting the best of me. So what does that look like when a student needs help?
Sure. So, and that's a really, really important question. So thank you for asking it, because I think it's important to realize it for yourself, but also for your friends and your peers as well. So for example, if you always like hanging out with your friends and they're inviting you out and you keep saying, no, thank you, no, thank you, no, thank you, that you just want to be home by yourself, that's not a good sign. If you're not able to sleep, if you're having insomnia, that's not a good sign. If you're sleeping a lot during the day when you would normally be doing activities, that's not a good sign. So if there are things that usually bring you joy, that usually bring you happiness, that you no longer want to do, that is a sign that there's something wrong. If there's changes in your appetite, you don't feel like eating as much anymore, or you're not really paying attention to your physical health. Maybe you used to exercise and now you can't bring yourself to get up and go for the jog. All of those are signs that something it may not be right.
So what spurred the idea for you guys to begin to look at mental health? Did the administrators come to you and say, oh, we're having so many issues here and we need help? How did that come about?
So not necessarily. We've been keeping a close look at the data since the beginning of the pandemic. We know just generally the stressors that have been put on children and young adults. And so I think it was sort of a combination of us reaching out and them reaching out. But really, one of the things that we're really wanting to do regularly in DHHS is really have conversations with people in the community, have conversations that are experiencing with the people that are experiencing these things. I always say, I'm not treating and preventing mental illness from my office in Raleigh. That's happening in the communities. That's happening, on a day-to-day basis with people living their lives. And those are the people we need to talk to. So that was part of the reason. We know that the stressors have been unprecedented, particularly on students. So that's why we wanted to reach out to the HBCUs and partner and do this together. And they've been fantastic partners, and we're really excited to see what comes out of this summit.
Very cool. So what about college students as compared to students who haven't reached college, like seniors in high school? So what are the differences maybe in the stressors and mental health? Is it the same? Are you looking at students the same or differently compared to where they are in their education?
Yeah, it's a great question. And it doesn't bear out in the data quite that way. I mean, I think one of the things is both of those periods of time pre-pandemic are very, very stressful for different reasons, right? When you're a senior in high school, you're launching, you're starting the next phase, you're ending a phase and moving on to the next phase. For many seniors in high school, one of the things that has been really stressful is that they didn't have the graduation ceremony, the party, the closure that really sort of wraps that phase of life. And that's been quite hard for many seniors to then make this transition where if, in normal times, you would have sort of a definitive end to that period of time, which was celebrated and acknowledged and all of those types of things. So that's obviously very stressful. Also in high school, the stress that you had of, for many students, they left school as a freshman, they returned back as a junior. That's very difficult, right? Freshman to junior year is quite different. Sophomore to senior year is quite different. So I think just sort of the normal development that would happen during your regular day at school, during your regular interaction, for many students, that was stopped.
Yes. So then tell me then, what are some of the things that are being done to help reverse the effect of COVID-19 on students and their mental health, now that you know that there's some need there for help?
Yeah. So one of the things that we are working to do is train teachers and train other people that interact with students. So school administrators, school resource officers, other people that just interact during the day with students, train them on recognizing the signs and symptoms of mental illness, because if you can recognize that early, you can intervene quickly. The other thing is conversations like this and really encouraging students to reach out for help and just trying to break down the stigma by talking directly to young people. I think that's really critically important. The other thing we're also doing is there's a lot of peer support that can happen. So young people helping each other, young people helping young people. That's something that's also very important to us to look at and continue to do. And at the same time, building up our services and support so that if a kid does end up needing care from a trained professional, that they have a place to go to get that care.
This has been fascinating, and the time has just really gone by so quickly. So maybe to wrap it up, like, what would you say to students, or maybe even their parents or administrators, anyone who comes into contact with college students, about how to identify and then how to help students get the help that they need in these spaces?
Sure. So the most important thing I think I can leave folks with, and the most important message, is that it is okay to seek help. If your child feels like they're struggling, do not feel ashamed to help your child, to ask your child, talk to each other. If you're a parent of a college student, ask them how they're doing, and not just how they're doing sort of on their grades, right? But ask them how they're doing emotionally, how they're feeling. In the same way that you would if your kid had a cold, you would check in and say, hey, how are you feeling? You can ask people those types of questions about their mental health. And often people don't realize that you can do that. And I very strongly encourage parents, students, administrators, anybody who's interacting with young people to do that on a regular basis.
Deepa Avula, Director of the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services at NCDHHS. Thank you so much for your time and this valuable information. We appreciate it. And one more thing, like, if anyone is interested in this particular service that DHHS provides, a contact number or website information on how they can find out more.
Hope for NC. Hope, the number 4 NC.
That is so concise and simple. Thank you so much again, Deepa, for your time and information.
Thank you so much for having me. And thank you so much for doing this important conversation.
You're welcome. And thank you, audience, for watching via YouTube, Facebook, and Instagram, as well as listening to WNCU 90.7 FM. Be sure to like us. We want you to follow us. We want you to subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, your host, and thank you again for tuning in.